We're going to share a little bit about how often this occurs, what it is, because many people are not familiar, and then the living experience. Of course, it's so important. I mean, how does this affect people in their real world, in their lives, in their homes, in their communities? So you'll hear about that. And we're going to start with giving you the background, the information about fetal alcohol spectrum disorders. And to do that, Dr. Christy Petrenko is here from New York, from the University of Rochester, and professor, research scientist, advocate, on and on and on. So she knows it all, and she's going to share with you information.
Thanks, Tom. Can everyone hear me okay? Or do I need to use my theater stage voice, which I could also do? All right, so I'm going to talk very briefly and give folks an update on the state of the science about fetal alcohol spectrum disorders. So if you've heard about fetal alcohol spectrum disorders, you've most likely heard about fetal alcohol syndrome, which is just one part of the spectrum. But what I want to emphasize is that it affects people differently, and it can vary quite a bit, from isolated mild effects all the way up to very severe effects, including higher rates of sudden infant death syndrome, miscarriage, and the like. But we often think about fetal alcohol spectrum disorders with the facial features that are associated with fetal alcohol syndrome, but only about 10 to 20% of people have those features. Most other people are appearing very typically developing, but have many lifelong difficulties as well as strengths that impact their lives. So one of the most surprising facts that people hear about fetal alcohol spectrum disorders is how common it is. If you haven't heard much about it, you think it's a fairly rare condition, right? But it actually impacts about 1 to 5% of the general population. So think of this as 1 in 20, or one child per classroom. But we know that rates of fetal alcohol spectrum disorders are even higher in special populations. So if you have folks in thinking about child welfare, mental health, the justice system, all have much higher rates of fetal alcohol spectrum disorders. So you will see this in all systems of care. Now, unfortunately, with fetal alcohol spectrum disorders, there are many barriers. And some of the barriers that our research shows include things like delayed diagnosis, difficulty qualifying for services, a lack of availability of services, and difficulty with quality once they are implemented. And our research has shown that many of these barriers are related to a lack of FASD knowledge and pervasive stigma across the community. So when people are unsupported, which most people with fetal alcohol spectrum disorders experience a lot of barriers, and many go undiagnosed in their life. Up to 80 to 90% go undiagnosed. And because of this, people with FASD are at risk for adverse life experiences in FASD. And these include things like mental health challenges, disrupted school experiences, trouble with the law, confinement, and substance use. Now, these are typically not due to the disability itself, but because folks are undersupported. And people with FASD can thrive when given the right resources. And research has shown that there are a number of protective factors that reduce the risk of these adverse life experiences. And these include things such as an early diagnosis, receiving developmental disability services, having a stable and nurturing home during childhood, as well as a diagnosis of fetal alcohol syndrome and lower IQ. And those last two are mainly markers for being able to get services. So the first three things on this list are all things that we can do things about. We really need the infrastructure and policies to support these kinds of practices that would really help with quality of life and people getting the services that they need to be able to thrive. We, in our research, have shown that there are a number of effective strategies and treatments that can support people with FASD across the lifespan. What you see here are the number of programs that have been studied at different ages. Most of our work has been during the childhood period, but there is increasing interest and focus on early childhood as well as adolescence and adulthood. So we know things that work as long as they're tailored to the neurodevelopmental profile of people with FASD. They often include a balance of skill building and environmental supports. The biggest challenge here is getting these into the community. And so we really need research and infrastructure and policy to make this happen. And I want to conclude with my section here about the economic impact of FASD. This data here that you see is from a recent study that looked at all the economic studies there have been published on FASD. And what they show here on the first side with the purple are the annual cost of illness estimates for children. And you can see FASD has even higher costs than very common disabilities such as autism. FASD is actually more prevalent than autism and unfortunately costs more given many of the burdens of lack of service. And then if we look on the adult side, with some of the comparable rates in diabetes and epilepsy, we have high costs. Now, the thing to remember about the costs here is that these costs could be significantly lowered if people are able to access disability resources and services, which could reduce some of the more higher cost treatments and services such as mental health and justice system and other child welfare placements that are much more costly and unfortunately lead to lower quality of life. So if we can get earlier services, the research would show that these numbers would come down quite a bit. So I wanted to give my contact information. I know that was brief, and I'm happy to provide more information to anybody at any of these resources or talk to people later today. I'm available. So.
Thank you, Christy. Do not hesitate to reach out to Christy or any of us wearing the Ask Me about fetal alcohol spectrum disorders, Ask Me about FASD shirts that you see. All right, so more prevalent than autism, but you didn't know that, did you? We probably can be shocking, and it's overlooked. It's overlooked, but you can treat it, you can intervene, you can address it, and you can save a lot of money, all of our money, which is important. I just want to take a very brief moment to tell you about the current federal response. So what's happening now? Because there are a few things going on. Fortunately, CDC is addressing from the public health standpoint, addressing FASD. You see there $11.5 million per year. That's been pretty steady for many years, over a decade, and has not been increased. Even though the issue, we've learned more about the issue. One of the things they also do is surveillance, try to understand, well, how many newborns have been exposed to alcohol prenatally, and that number continues to rise, 1 in 7, very significant. The NIH does do research, so we're fortunate that now for 50 years we've done the research, and we know how alcohol interferes with human development. We know how to address it. We just need to invest on behalf of people who live with FASD. And how are we doing? Well, we have $1 million. 1 million public dollars to do that right now at HRSA. So that is the major gap as we look at the companion efforts to the research and the public health. We do have $5 million at the DoD to investigate FASD in the military health system. So that's a promising opportunity within that system, and hopefully we can address the clinical management, and then that would have a civilian application. But that's a few years down the road until it reaches those who are in need now. So that's what's happening now, and you're going to hear a little bit later what the FASD Respect Act does and how it addresses this gap. But first, we want to talk about sort of the human side of this. And I'm going to introduce Sean Patrick to come up and talk to you. And like I found out, if you talked with him for half an hour, you would say, I'm going to introduce my best friend, Sean Patrick. Because you can still be very charismatic, as you'll see, even if you've been affected prenatally by alcohol. And he has a very powerful and, I think more importantly, inspiring story about living with FASD and some of his strengths. Because after all, I mean, we all have challenges. I know I do. But I think for me, our environment and our society is sort of set up to allow me to still succeed and do well. So really what we need to do is to accommodate a bit more so people with FASD can do the same, because they have strengths that need to be emphasized, and they need the opportunity to do so. So Sean Patrick, where are you? There you are. Come on up. Come on up.
Okay. Good afternoon. It's nice to see everybody. My name is Sean Patrick Bousquet. I have many strengths and challenges. One of my strengths is advocating for myself and for others who have been impacted by FASD. I've had the opportunity to speak with the Department of Defense through FASD United, Public Defender's FASD training in Texas and Florida, and I recently spoke at the National Council of Adoptable Children Conference in Kansas. I was in the Texas foster care system and was adopted by age 5. At age 2, while still in foster care, I was given the diagnosis of ODD, oppositional defiance disorder. Once adopted, I started the journey of getting an alphabet soup of diagnosis, both behavioral and medical, ranging from ADHD to autism and heart murmur to orthopedic issues. Unfortunately, it wasn't until my mid-teens that I finally received the FASD diagnosis that connected all the dots for my mental and physical health. The FASD Respect Act would have helped my numerous providers, specialists, and therapists to diagnose me much earlier and provided a treatment plan for early intervention. The medical and mental health care systems need the FASD Respect Act. Perhaps my trajectory of attending 8 different schools would have been different if my educators would have been informed and trained about how FASD affects my executive functioning. The education system needs the FASD Respect Act. I firmly believe that if I had been given the diagnosis at an earlier age, it would have given my supporters the knowledge that I needed to be my external brain, and I wouldn't have entered the juvenile justice system and endured more trauma. The judicial system needs the FASD Respect Act. FASD is a whole-body diagnosis that affects all areas of my life, every single day. I refer to my supporter as my personal Jiminy Cricket, because I do have trouble with impulsivity, social skills, consequences, or seeing the big picture, etc. I refer to my brain having 2 sets of transmitters that have trouble connecting. One set knows exactly where to go in my brain, but doesn't have a clue what it's supposed to do when it gets there. The other set of transmitters knows exactly what it is supposed to do, but doesn't know where to go in my brain. I can do many things. I am musically and artistically talented, and I love to build things, but I struggle with adaptive functioning, like daily living skills, navigating when it's safe to cross the road, etc. Making decisions can be stressful for me. Oh, I'm sorry, I think I'm pushing buttons. Like when my mom and I are running errands in our neighborhood, she randomly asked me if I want to have a hamburger or pizza for lunch. To her, that is a very simple question. She's only given me 2 choices. She's expecting me to respond in probably 10 seconds. Or less. Meanwhile, I'm taking at least 30 seconds to a minute or more to process the question and the thoughts going on in my head like, what did she say? I might ask her to repeat it. And internally ask myself questions like, am I even hungry? Where would we go? I wonder what she wants to eat. Is it a place that I've been to before? It better be. Did I like it last time? Meanwhile, she may get impatient with me. But I need the time to process what was said and time to respond to it. I may even seem to get agitated and say I don't want anything because it's easier than the pressure that I feel when having to answer a question or make a decision. Imagine if it was a more important question about something much more serious and by someone who didn't understand FASD. The potential for catastrophic consequences would most definitely be increased. I need the FASD Respect Act to be passed for my future. As an individual who is impacted with FASD, I deserve to have the safe living environment with appropriate supports and scaffolding. I want and need the opportunity to thrive, not just survive. It is important that you support the legislation for my sake and for others who are impacted by FASD. Thank you for your time, and I greatly appreciate it.
See, I told you. This guy, come on. Okay, all right, so now you've heard a little bit about FASD and how it affects people. What we've done, we've taken with Sean Patrick and many others. And by the way, with the blue shirts, we have, I don't know how many full, additional folks running around the Hill right now in meetings, both sides, who are not here today, but are not here with us in the room. But we listen to them, try to understand, okay, how do we craft a legislation working with you all, with staff, that will address the needs and can do it as quickly as possible. And again, complement the federal response right now. And so to do that, we have a policy team. Jen Wisdahl leads our policy team and is fabulous and helps organize all these folks. And may have talked with you or certainly your colleagues. And we also have sort of the person who guides us, and that is Susan Shepard Carlson. She is the former First Lady of Minnesota, and we are fortunate enough that 25 years ago or so decided to make this her leading sort of advocacy effort, and she had seen this firsthand and realized we've got to do something about it. And we have been, but there's still much more to accomplish. So Susan, I want to ask you to come up to talk about the FASD Respect Act, which had been over a 50-page bill in the previous Congress, is now, I think, 4 pages. It's succinct, and we're ready to roll.
Good afternoon, everyone. And these are your partners in crime. And I just want to thank you all for being here today. And I thank the health staffers. I know that it's a busy time, particularly in Congress right now. They're doing appropriations bills. And actually, the members of Congress have extended the week. They were going to be leaving today, and now they're leaving Saturday. So I know a lot of you are being pulled in those directions. This is being taped, so hopefully we'll be able to share it with those health staffers that weren't here. But we also have our Army out here. We've had an Army over the past 2+ years. This started with COVID. Well, I shouldn't say it started with COVID, but COVID gave us the opportunity, as you all know, to connect with members of Congress and their staff like never before. And so since March of 2021, before the FASD Respect Act had a number last Congress, we started those meetings, and many of you in this room and around the country. And it's professionals, it's those with lived experience like Sean Patrick. You have and parents all around the country. You have become our family. You have taken this on, and we just can't thank you enough. So I just want to say that. And members of Congress and staff are hearing the stories, and that I think is what's so important. I'm a policy wonk. I started this journey back in 1997 as a juvenile court justice officer in Hennepin County. I was also First Lady, which was fortunate because it gave me a platform, but it was what I saw in juvenile court with the substance abuse problems and the families. And we were not even questioning whether there might be a problem with these youth. And I must say, when children with autism would come into our courtroom, there was a response and an understanding of that disability. FASD was not even thought of or even considered, and you would, and as you've heard, we have a prevalence much greater than autism. Autism has been, the field has done well in funding, and that helps with a systemic response. And that's what this field really needs, is a systemic response. This was diagnosed 50 years ago. I've been involved in half that time, and we don't have a systemic response. We have research, we're learning a lot. We've learned a lot since I've been in the field. We've learned through research, thank you, Christy and all the researchers, that if we identify these kids and we begin to understand their challenges and their strengths, they can thrive. So I'm going to just give you a little history. This is a reauthorization bill for staffers. The first FASD program authorization was in 1998 after the Institute of Medicine study found that alcohol causes far more permanent harm than any other substance combined. And so Congress authorized 27 million, and then in 2001, it was appropriated. And part of the money that remains, as Tom talked about, is at the Centers for Disease Control. And then there was another 15 million that went to a Center for Excellence and 2 million for a national task force. The reauthorization language expired in 2007. The Center for Excellence was operational till 2016. It was defunded in 2016. We made a lot of progress. I must say, as Hennepin County District Court actually got some of that funds from the FASD Center for Excellence, and I know some people in the room were part of funds from that Center for Excellence. We did screening in our system, and about 25% of those kids that we screened in juvenile court ended up with a diagnosis within the FASD umbrella. But more importantly, when we educated the providers, the caretakers, the education system, the outcomes of these youth that were on the wrong trajectory improved dramatically. And so we know that it works. We know even if you wait until they get into the juvenile justice system, it can work. So that's why the FASD Respect Act now is reauthorizing. And last Congress we had, as Tom mentioned, we had a long bill, and we had a lot of authors, a lot of support. This is a bipartisan bill, and we got it towards the end of Congress, and we were working with the Senate Help Committee staff, ranking member and majority staff, and they said we need priorities. It's just too much language, too long of a bill. So we had priority language that became what you see before you today, the FASD Respect Act. And what it does is takes the code language that was passed back in 1998 and amends that and adds priorities from the Respect Act from last Congress. And so, and you may ask, well, what were those priorities? And I'll have to say, when we started this process 2+ years ago, I don't know that we could have said what the priorities, but Jen and I, and she's going to chime in here when she sees I've forgotten something. And she's also, we've got lots of good, we have been doing this together for 2.5 years, listening to all of the stories, and we have learned so much from you and people in the field, just what are those priorities. And the Respect Act, there's one section on which is called the Building FASD State and Tribal Systems of Care. And it's really important that states begin to look at this problem in a systemic fashion, because because of this, I've gone through all appropriations bills, and there are so many appropriations in those silos of care that deal with issues that are related to FASD. But unfortunately, FASD is left out of the discussion. And so this will allow states to begin to look at those silos of care. I'm talking about substance abuse. I'm talking about mental health. I'm talking about behavioral health. I'm talking justice. I'm talking education. So there's all of those. And just with money to begin to look at how we can start doing a systemic way of screening in early childhood, screening from the very beginning, similar to other health conditions. So there's that section. We're bringing back the Center for Excellence to begin to look at and bring together all the good things that we've learned through research and practice over the years, and allow and replicate that around the country. And so those are the two main provisions. So we want as many co-sponsors. So if you're a health staffer here, we want your member to become a co-sponsor, and maybe Jen can give you an update on that. Current status, that's our we want to get the co-sponsors. Senator Cassidy put the Respect Act language in what a bill called the Support Reauthorization Act. It's the marker bill that he's hoping to have come out of the Senate. So there's that vehicle. And so we're hoping that it will become, we're also looking at having it come as its own bill in the Senate through what we call a hotline process and emergency authorization here in the House. So, but the more support we can get from bill sponsors around the country, bipartisan support, the more likelihood that it'll pass. So Jen Wisdahl, my partner in crime, she's been, we didn't know each other at all, and now we are
Like the best of friends.
the best of friends. So thank you all.
Yeah.
And we're going to save time. We've got time for questions and answers.
Of course. So I want to take it back a little bit to the lived experience. So I work with FASD United, the national organization. I work on policy, but I didn't get there because I have a background in policy. I'm a mom. I'm a mom to 3 kids with FASD. And I want to talk to you a little bit about my oldest. My oldest, Nathan, was born to a delightful young woman who didn't have access to health care and binge drank before she recognized she was pregnant. Never has had a substance use disorder, never has had an alcohol use disorder, and we know that that can often be the case because FASD can occur prior to recognition of pregnancy. So this isn't just a situation of people with alcohol use disorder or substance use disorder. My son, I ended up in the foster care system and went through 5 sets of parents by the age of 5 because his behaviors were so big and there was no FASD related support for him. 5 sets of parents by the age of 5. That makes my heart break. Had the foster care system been informed about FASD, had knowledge, had training, had support, all things that can be done through the FASD Respect Act, my son would have been saved that trauma. I might not have been able to be his mom, but as his mom, that's what I would have wished for him. Now, we were fortunate where we lived at the time. There were pockets and pilot projects that were being done through the Center for Excellence and through great research coming out of my home state of Washington. And we were able to get some FASD-informed care through that brief window, those pilot projects, right? And I have to say, my son is doing well now. He turns 21 next month. He's going to school to be a social worker and has a full-time job and graduated from high school doing well. But he's doing well because he had access to the FASD-informed supports and services. Had he not, I wonder how many foster homes he would have gone through. So this is the critical nature of what we're asking for. We're asking for upstream investment so that the downstream issues don't happen. You know, you look at the rates, 90%, over 90% of individuals with an FASD will develop co-occurring mental health issues. Here's the problem. I know Congress has done a ton of work on mental health, and we appreciate it. But unless that mental health care is FASD informed, it doesn't work. It doesn't work for our people. And this is where, again, the building FASD state and tribal systems, states can begin to look at their mental health care systems and not create something completely new, but start putting FASD into the mix. Congress has done a ton of work on opiates. Alcohol is so commonly used with opiates. Neonatal abstinence syndrome, 2 of my kids had neonatal abstinence syndrome. That's not what they live with lifelong. FASD is. FASD does lifelong cell-changing work on a person. This isn't going away. The FASD Respect Act would help integrate FASD work into the work that's being done on substance use and prevention. And we need that. So I'd really like to thank our authors. I'd like to thank Representative Don Bacon from the great state of Nebraska. Oh, and I see Matt here, yes. I'd like to thank Representative Betty McCollum from the great state of Minnesota, Senator Amy Klobuchar from Minnesota, and then Representative Lisa Murkowski from Alaska oh, sorry, Senator, I apologize for the Alaskans in the room. Senator Murkowski. We'd like to thank them and definitely would like to open the floor to any questions that you might have. And if we don't have the answers, we have a room full of lived experience. Raise your hand if you're a parent to somebody with FASD. Fantastic. Raise your hand if you're a person with FASD. So if you have any, if you're a grandparent of a person with FASD. So if you have any questions, we'd love to hear them. And there's no bad questions. There's nothing that's going to offend us. There's nothing that's going to, I'm going to phrase it the wrong way. Please feel free to ask. And nobody wants to be first.
I'm just curious, when you talk about early screening, what does screening look like? Like, what has to happen in order to get that diagnosis?
That is a fantastic question. Christy, do you want to handle that one? Cool. It helps to have diagnosticians and researchers in the room.
And I could talk from the juvenile justice system. Too.
Yeah, so screening can look a wide range of ways depending on where you are. Ideally, screening is happening in every system of care. The least effective way to screen is say, did you drink alcohol? Yes, no. The best way is to ask, if you have the person who was pregnant with that individual, you can ask them before you knew you were pregnant, what was your alcohol exposure or what was your alcohol use like? And you can get a flavor and develop a non-judgmental, warm exchange to get the most accurate information. But unfortunately with FASD, a lot of times people are removed from their home of family of origin, and so maybe in foster care, adoptive care, maybe in different situations where we don't have that information anymore. And so we have to rely on medical records and documentation, which unfortunately most of our providers don't have the opportunity right now in their training to learn about FASD. And so that's a limitation, but we may have relatives or other people we can screen and ask, but we should be asking in mental health, we should be asking in the justice system, we should be asking in medical, all over, because it affects every system of care. I don't know if you want to say anything else.
I just want to say we did it in our juvenile justice system, and we had social workers who would interview whoever came to court with the children, and we had developed questions similar to what Christy's talking about. We ended up the first year with more than we could handle as a program, and so we were asked to narrow that, and so there's a what they call a Macy 2, and Christine can explain, but it's a mental health screen that the youth answers, and so we used that as our screen out first, and those that screened positive on, I think it's positive, ended up then we would screen with the prenatal alcohol history and that kind of thing. 40% of those ended up getting a diagnosis with FASD. But more importantly, when we educated those in the justice system about this disability, because there's information, a lot of information in the child protection files as well as in the juvenile delinquency files, 100% of the referrals from court ended up with a diagnosis of FASD. So that they saw it, and those youth were able to get a diagnosis.
Screening is very effective when we do it. So it's helping people see the advantages of why knowing about FASD is important. And the big advantage is that it really makes a difference in the response. And the biggest thing is this idea of reframing that we've seen in the literature, that when we can recognize a person's symptoms and behaviors as having a neurological basis, it changes what we do about it. We can put accommodations and support in place that help that person fit in their environment and be successful. And so that is really what we need to do. And it's just when people hear and learn about FASD, they're like, oh, yes, we need to do something about this, and they come on board. But we don't have that awareness and education built in now currently.
Sure. Lucy from Congressman Caston's office. I heard one of the speakers mention that FASD diagnoses are on the rise. Is that due to better diagnostic procedure, more access to diagnosis, or does that have to do with underlying alcohol use disorder? Where might we be able to intervene in the process earlier upstream to lower that number?
That's a really fantastic question. Although our diagnostic capacity is increasing, one of the points that I meant to emphasize earlier is that there is no currently any state that has adequate diagnostic capacity. And there are many states that have no diagnostic capacity. Many families have to go out of state. I think there is growing awareness to some degree, especially in communities that have developed some capacity, that people are looking and asking more. There, during COVID, was an increase in alcohol use, and so we may see a rise. But also it's in how we've defined, just like with autism. Some of it is we've gotten better at identifying people across the broader range. So we're seeing it more, but our active case ascertainment studies where we go and screen everybody, we're seeing much higher rates than we did when we were just waiting for passive information to come through. So about 5% is the current estimate based on those studies. Any other? Oh, sorry.
Well, I just wanted to add something to that, because we know that the bulk of that 1 in 20 don't have a diagnosis. In fact, the study, and I don't know if you mentioned it, only 2 out of that study actually had a diagnosis. So they're out in our community, but unrecognized individuals. And I think a study that doesn't get mentioned a lot, and it wasn't related to FASD particularly, it is the ABCD study. And what that found, and they weren't looking for it, but one of the questions they asked was prenatal alcohol exposure before confirmation of pregnancy. And they found 26% of those youths were prenatally exposed before confirmation, with a high correlation of problem behaviors under a problem behavior checklist. And that study did not include foster care. So that gets to, 26% of those youths had a high correlation between prenatal alcohol exposure before recognition and problem behaviors. High correlation. So, any other questions? Good questions.
So in our state, we are trying to do we're trying to do more screening in corrections, but because of the I don't know if this is a federal or a state restriction, but you can't experiment on people who are incarcerated, and so they can't use the screening tool. We've been hung up for 10 years because we can't find a screening tool that is standardized to screen in the adult correctional population. So is there a new tool that's come up in the last 10 years that we could use?
I will definitely look into that. I know that I don't think that's you can't do research studies there are limitations in research you can do in justice settings, but there are potential. So that may be an individual state or a policy issue, but I can look into specific measures and see if there's anything newer that's come up that would work.
Our Department of Corrections is ready to start screening. They believe in it, they understand it in FASD, and they want to do it, but they just are hung up on this.
On the measure.
Yeah.
Can I respond to that too?
Sure, Annette.
From California. We are actually working with our state now. There's a judge who is a retired juvenile court judge. For some reason, these judges know FASD. They do more than anybody else. But at any rate, we are working in California. They're working right now with Dr. Jones on a screening tool for the juvenile justice system, because this woman is now at the Department of Health and Human Services, this retired judge, and she's determined to reform the juvenile justice system in California. So we'll collaborate. Okay.
Well, and oftentimes you can get a judge to sign an order, and we had that in our screening program. And a judge. We have a judge.
Speaking as retired Superior Court judge, I was judge for 36 years, but in Alaska at age 70, you're out. It's in the Constitution. Really what I wanted to highlight is I was a judge for probably 8 years or so before, and Strysmooth came to Barrow, and I got clued in about what was going on. But the thing that grabbed me, and it has led to decades of getting involved in this, is that most times you can't tell by the way someone looks or the way they talk. You cannot tell. And I was just like everybody else doing court hearings. I think it, trying to do a good job and so on, but not really accommodating. And then after Ann's speech and stuff, I thought, oh, this is huge, but I also had to realize I don't run the DA's office and all these other ones, but I do run my courtroom. So what I personally did was slow down the hearings, and also like commonly used forms like my bail order was no longer a bunch of legalese, but plain English, positive wording, white spaces and stuff like that. And then taking into account as much as the law allowed. But it is a real hard issue because you cannot tell. So for most of the people. So you just have to get clued in. And that's what the FASD Respect Act will help do.
Thank you, Judge Jeffries, for all your service in this field. I know we've got a few other staffers. Any burning questions? I know we've heard a lot of questions over the 2+ years, so any question is appropriate. We'll be able to answer it or get back to you. And there is you can contact FASD United. We have a website, and there's a whole section on our policy center with a link just for staffers with all the information that you need on rationale and what the language will look like when it's put into the code, because it takes the old code and amends it, so it's hard to know what it looks like. So there's a lot of information on that page, and then it talks about what the history of appropriations, so you can see that.
So before we close, I'd like to, again, bring it back to the lived experience, if that's okay. And I'm going to leave you with Justin Shepard to talk about his experience. And then we'll give you some of your time back, because I know as staffers you are incredibly busy, and having a meeting end a little bit early is probably not going to feel like the worst thing.
Hello, everyone. I'm Justin Shepard, and I have been around FASD for many years. My wife is a researcher at the University of California, Irvine. In 2020, my brother and I set out on the road to make a film to help raise awareness around this topic. And as I went out on the road and I started hearing the stories all across the country, from all these different walks of life and different areas of the U.S., I started hearing a lot of myself, and so when I got back, I sought out a diagnosis and found out I too have an FASD. And I tell this story because I think it helps speak to the prevalence of this out there. Someone asked, screening processes and such. We don't really know the true numbers, right? Because diagnosing is very difficult, and that's where we're at with the FASD Respect Act and why it's so important that we get resources out to communities to help people get screened in all the system. In all of the systems, not just the foster care, but in everywhere. And it will be very helpful. When I made the film, and I think this is important that from a political standpoint, why the FASD Respect Act is so helpful from a legislative standpoint is because it is intrinsically tied into many issues in the U.S. that politicians are forced to look at day in and day out that their constituents are looking to them to take care of, such as homelessness, the public education system. These are the main talking points. Again, healthcare access for individuals living with disability. This community, you can find FASD in all of those areas, and so it's an umbrella topic. So when you address FASD, you're looking and helping homelessness population as well, if that makes sense. You're helping the healthcare, industry in itself. It's a huge economic impact, right? And that's another thing for people who might say, well, how does it bother me? Well, I guarantee you, whether you know it or not, you know someone with an FASD. They may not know it. This is why the FASD Respect Act is so important in the work that FASD United is doing. So, I'll end on this, that, my diagnosis changed my life. It also, I feel like, saved my life. I learned how to advocate for myself in a way and take my health issues seriously. I've had heart issues my whole life, and last year I started having really bad chest pain. And normally I would just go along with the dismissiveness that I'm received with at the doctor's office, but with my diagnosis in place and knowing all of the other things that I have, my wife helped push and get me. I found out I have an Al Kappa, which is a rare congenital birth defect, and I had to be rushed to the Mayo for open heart surgery, which saved my life. So in translation, getting, as someone who looks healthy, as it was brought up, and you may not look at me and see FASD. That's the thing about it. That's why we're here, right? But it's here. It's me. I am FASD, Sean Patrick. There are many people living with this that need help. And it starts here at the federal level and it gets down to the community level. People are on the ground at the community level already fighting every day. They've been fighting this battle for 50 years since this came to fruition and was brought to the world by Dr. Ken Jones and others. And so that's why we're here today, to relay this information and really advocate and plead for your support for the FASD Respect Act. So with that, thank you guys so much.